Wow, am I glad to be here today speaking with you. I'm sorry I can't be there in person, but really this is an opportunity to celebrate 30 years of building capacity from Fogarty in Rakai. Never has such a small community in Uganda provided so much power to discovery and to helping the health of people around the world with HIV. Let me review with you our activities with Rakai over the years because it's an amazing opportunity to think of what we've done. I'm speaking here after Dr. Eliota, your Minister of Science and Technology, and he was a Fogarty Fellow. I didn't realize that until he spoke at the MEPI meeting, told us about his time at Western Reserve in Cleveland, how he saw snow for the very first time and learned how to use a computer. He told us that without Fogarty, his career would have been totally different. It would not be who he is today. So it made me feel great about the opportunities that Fogarty has had and the impact in Uganda. You know, the AIDS epidemic started in Uganda as slim disease. And I remember very well, as someone who's worked on enteric diseases for so long, that paper by David Sirwada and Nelson Suinkambo describing the first activities of HIV in Uganda. It was a seminal paper and awoken the world to the problems ahead. In 1987, the third AIDS conference, International AIDS Conference, was hosted in Washington, D.C., and our own Ken Brinboard, head of our Division of International Training and Research, was the co-chairman of that committee with George Galasso. And it was his idea to begin the Fogarty's program. At that meeting, Jonathan Mann was prescient in deciding and stating that this epidemic of HIV was going to influence the world with millions of deaths and billions of dollars to address the epidemic over the next 5 years. Really prescient. Ken began our extramural program at Fogarty with the ATERP program, the program that you've had at Rakai for over 30 years now. Ken, during this program, we've trained more than 2,000 scientists and researchers from over 100 developing countries. It's a contribution that can't be properly valued, but Ken has made such a seminal contribution that he was awarded the Director's Award from the NIH Director, the award from the HTPN just this year, and the CUGH Award, the Consortium of Universities for Global Health. He's really instrumental in getting Fogarty's extramural programs going. In our 50th anniversary volume, we celebrated last year, this comment by Fred Nalagota was outstanding. He mentioned that when he first went to Rakai, HIV was a death sentence. And as he looked back over the years, he's seen that now people with HIV go on and live a healthy life and can be cured. It's a chronic disease, an observation that has been changed because of the research done by all of you in Rakai, a relatively small group. Now, over the years, over the past 30 plus years, Fogarty has had a consistent group of grants from the ATRIP program of Ken Bridboard that began with Hopkins, with B. Frank Polk in 1988, who was followed by Harvey Fishman for 2 rounds of that training grant. It went on with Chris Bearer, who took it for 3 rounds. Ron Gray picked up twice, and Larry Chang most recently. You've had really 35 years of nonstop funding from Fogarty in this program, and together this has made an amazing impact on training. One thing I would note is that all of these D43 grants that we've given, the ATERP grants, have been given to Hopkins faculty. None have gone to a Ugandan PI, and that's something we'd love to see in the future. But 35 years, an amazing record. Along the way, we've trained lots of people, over 140, in a variety of degree programs, PhDs, postdocs, and the like. These programs have really changed the panorama. And your leadership group at Rakai Health Science Program has been outstanding. All of the Ugandan leaders have in some way benefited from Fogarty programs, from the top, from David Serwata and Nelson Suncambo, and from your partners with Ron Gray and Maria Waywar, and Tom Quinn, of course, and others. But this group has been extraordinary. There are many other people who have been trained at Rakai who have gone on, and they're too numerous to count, but they're really an amazing group. And you've benefited from lots of short courses and non-degree courses in a variety of topics. It's been a major change maker. Currently, you have 6 grants from the NIH, and what's interesting to me is that while you started with all your grants from allergy infectious diseases and the Office of AIDS Research, now you've gone on to grants with child health and mental health. So you're diversifying your portfolio, you're expanding what you're doing and the research you're funding. I have to give a shout out to Johns Hopkins, because in this review of our people in Uganda, you list all of these trained